We're here to see Dr. Gale concerning our son's diagnosis of ADHD.
Right through this door.
Hello. I will discuss several topics concerning this disorder. ADHD stands for Attention Deficit Hyperactivity Disorder. Children with ADHD have deficits in the executive functioning of their brain. Executive functioning involves processes such as your child's working memory, his impulse control, and his allocation of attention. Functional deficits in these areas are what cause ADHD symptoms. There are two separate categories of symptoms for ADHD. The first category belongs to symptoms of inattention. Example: easily distracted, frequently losing objects, reluctance to engage in tasks that require sustained mental effort. The second belongs to symptoms of hyperactivity and impulsivity. Example: acting without thinking, impatience, difficulty resisting temptations. This results in behavior that is socially inappropriate and disruptive to others, as well as difficulty learning. Proper diagnosis of ADHD is done according to the Diagnostic and Statistical Manual of Mental Disorders. Additional mental disorders are often present in children who have ADHD, such as depression and oppositional defiant disorder. It is difficult to notice and diagnose these different disorders because of their overlap in symptoms with ADHD. For example, difficulty focusing attention and difficulty sleeping are prevalent in ADHD as well as depression. Symptoms of depression, therefore, could easily get overlooked. You must be aware of these overlaps and cautious of other disorders your child may have. Caring for a child with ADHD causes stress. But you must remain compassionate and caring. Children with ADHD want to behave well, but cannot control their actions as well as you and I can. Your child's siblings may become frustrated with him and show resentment. They will probably receive less attention from you and less reward and congratulation for their successes. Siblings, however, should take on responsibilities in looking after your child with ADHD. It is wrong to assume he will outgrow ADHD. Intervene as early as possible in your child's life with accommodations to better deal with their behavior. He will require additional supervision and concise rules. Be consistent with your rules and expectations. Your child needs structure. Determine fundamental rules and boundaries of behavior that must be followed at all times. Emphasize behaviors and activities that he is having particular trouble with. For example, no hitting. Do not interrupt people talking. Keep clothing folded. And always finish chores. You should also produce a schedule for your child. Consistently enforce the schedule. Keep your child busy. Leave reminders of these rules and the schedule throughout your child's environment, like in his bedroom and the kitchen. Provide your child with immediate feedback to his behavior. If your child breaks the rules or the schedule, respond immediately and apply the consequences. Always reward his successes. Reinforce positive behavior. Eliminate distractions from his environment. He should do his homework somewhere without television or video games. Children with ADHD have difficulty making friends because of their impaired social skills. They do not realize their behavior is disruptive and inappropriate. Your child, however, can benefit from positive peer relationships. It is beneficial that you coach him on various social skills. You can try rehearsing social scenarios at home, which he can later practice in real life. I would also recommend him joining a sports team. The physical activity and social interaction is beneficial. Apart from these accommodations, which should also be made at school, ADHD is often treated with medication and behavioral modification therapy. You may be skeptical about the use of prescription drugs for treating children. However, stimulants, such as Ritalin, are very effective and recommended. It is optimal that medication be taken in conjunction with some form of behavior modification therapy. This can take place in a similar office, where we will discuss your child's actions and invoke strategies to eliminate negative behaviors and reinforce positive ones. Hopefully, this discussion has provided you with valuable information. Goodbye.